So what can you do while your back is still hurting, but you still have to live and take care of your house, your family, and still move in a daily life? What can you still do to protect your back and take care of your family? Here are a few strategies. One, the first thing we want to do is protect the back. We don't want to hurt it more further than where it's hurting right now. We don't want to make it more injured from where it's at, so we want to protect it. So we're going to use some sparing strategies to protect your back and continue to move. Also, things to help heal it more, so some exercises, some things just to do while you're at the house. So here's Aaron, he's going to show a few things. While your back's hurting, a lot of times it's bending forwards that hurts. So when you have to get up, you bend forwards to get down from sitting, or get up from sitting to get down to sitting many, many times. Here's one strategy we share with you to protect your back while you can still do that. Get down, get your kids, put your shoes on, instead of grinding your back. What you'll grab is a broom or a pole or a stick like this. You're going to place it behind your back and have 3 points of your spine touch this pole at all times. So your head, upper back, and middle back. This is a hip hinge movement pattern, a hip hinge exercise to use while you are throughout your day to get up from sitting, go down to sit. So Aaron's going to perform this for us. He's going to hold the pole behind his back. He's stand this way. Put his one hand up here behind your neck. Okay, so you guys got his head touching, turn a little bit, head touching, upper back, and right below his belt line, okay? So when he goes to sit down, all 3 points are always going to be touching this pole. So Aaron, slide the pole just a tiny bit. Okay, you go feet shoulder width apart. So as you sit down, there's a chair behind you. You're going to push your hips back. Try to keep all points touching the pole. Good. Back up. Back up. Good. Okay. Back down. Back up. Turn slightly at the corner of the chair. Okay. So as you see, he's straight. You can bend down a little bit. Chair's there. Okay. Come back up. Back is straight. That is the spine sparing strategy. As you do it, you're going to engage your core a little bit. Push my fingers out. Bend down. Good. Come back up. Okay. What would happen that would hurt your back is if you bend your spine, so bend your spine, go sit down like normal, like you would. As you go do that without a pull, probably what you're doing throughout the day is that you're bending your spine here, you're losing contact either here at your lower back or your head with the pull, and that's what's going to irritate your lower back over and over and over again, especially if it's already hurt. So we want to use this pattern when we do bend forward to pick something up or to sit down while your back is in some pain. The next thing we want would be to, while you are sitting can put a lot of pressure on your lower back. So while you do sit, you want to keep your back in a neutral position. A good way to do that would be a pillow like this. This is a Mckenzie Lumbar roll pillow. You can get it off Amazon, or we have it here, or a rolled up towel or a pillow. What you want to do is while you sit, you're going to place this pillow, scoot all the way back to the edge of the chair, and forward a bit. You're going to place this pillow just on the very, very low part of your back. And as you sit back normally, that's going to keep your back in a neutral position or prevent that spine from in a flexed position. And that can really irritate, especially if you have a disc bulge, disc irritation, that's causing some of your pain. This is one of the best sitting postures, supports that you can have while you're driving, sitting at the table or at your house. So other strategies for your lower back. While it's in pain, don't sleep on your stomach. Avoid sleeping on your stomach as much as you can while you're sleeping. If you sleep on your side, put in a pillow between your knees can help. If you sleep on your back, put in a pillow underneath your knees can help. And those are some common recommendations that I typically give to someone with lower back pain while they're at their house and while they're continuing to live. Those are some of the top things that I've seen help with your lower back pain. So do those and continue to find help from a professional as you need.